Hi, everybody. This is Dr. Kogan from GW Center for Integrative Medicine. Have wonderful pleasure today to welcome Sharon Democker and Dr. Sharon Democker and Dr. Orceyre. We're going to talk about integrative primary care. And this concept is not exactly the same as people think of general primary care. So we're going to open this up a little bit. And the reason for that, or the reason we decided to do this discussion today is that Sharon, who recently joined us, is Andrew Weil fellowship trained, who used to run for many years variety of integrative primary care practices at the Veterans Affairs Hospital, and before that in her own private practice. And so we have this wonderful opportunity for some of our patients to engage in our clinic in more of a primary care model. And so I'm going to speak for a minute before handling to our experts. When I was in residency, I did this very interesting social medicine residency program, and I was convinced I'm going to do primary care. And the primary care model is really that you are a primary provider, of course, and that you're going to provide pretty much anything to the patient. And only when you need specific expertise you cannot provide that you're going to send the patients to specialists. What I've been realizing over the years, and this was my dream always, that I will come to the center, will make the whole center to be integrative primary care. It's going to work wonderful. Well, it turned out there are a lot of really major issues. We don't really have a primary care in this country. We just don't. What we have is a gatekeeping. So your current primary care works as a gatekeeper. You come to your primary care and they just basically look at you for 5 minutes and say, okay, you have a GI problem, go see a GI doctor. You have a heart problem, go see a heart doctor. And really, the way insurances reimbursements work and the way the complexity of our system is that you don't really spend, as it used to be, hours with your doctor because your doctor knows you well, because your doctor is the only game in town pretty much. And you know, you have to figure out, the doctor and you have to figure out what's going on and how to address it. And partially because of that, and partially because I felt it's hard to ask us to have our patients pay out of pocket for primary care. In the beginning, for about 10 years, we never really talked about it in our clinic. We had a number of our patients who call us primary care center for them, but that's because they want, not because we were feeling like we can do that. But I feel like things are changing. I think the system is so bad that a lot of patients voting with their feet, they simply living the standard rapid practice, like a regular quick turnaround primary care practices. And I think with that in mind, I feel like it's actually okay for us to try this. So we're going to have two models. The one model will be kind of a basic fee for service. You just come whatever you need to get. We would recommend come see us at least once a year if you're completely healthy, just for kind of an annual physical. But we're also going to do a concierge, and our concierge will allow patients to have access to us much quicker. We will have longer time. We will have some way of very quick correspondence through the system with the doctor, not with just front desk. And we also going to have some perks. There are going to be some discounts for certain things. There's going to be an accelerated process to see us if you need to see face-to-face. So you're not going to wait for, say, a week before you can see someone. So it's going to be all expedited. And we'll see how see if our patients like it. And we will be, of course, for all of our primary care patients, we will have all the specialty care, or most of it, through GW, and it will be a lot faster than you can get there. The patients get there by their own, because our referral system already in place for that. Plus, you know, we actually have a pretty large network, not just at GW. So with that, it's enough of me talking. I'm gonna, I guess let's start with Deidre, because she's been at the clinic longest and she's been doing naturopathic primary care for quite a while. So maybe Dr. Sarah, you can speak a little bit about naturopathic primary care, and then we'll hand it off to Sharon. Dr. Sarah, can you unmute yourself, please?
Thank you. Thank you very much, Misha. And I wanted to start off just by saying how happy I am to welcome Dr. Democker here. I'm really pleased that she's joined us, and I'm also very excited about what you have to offer our patients. So I have questions for you. Maybe we'll get a chance to talk about them in this discussion, or maybe not. Maybe we'll save it for another time. But as I see it, I have lots of patients who have been working with me for a long time and kind of use our relationship as a primary care relationship. So they'll contact me if they're not feeling well, and I'll try to fit them in quickly if I can on my schedule. Or if they have something emergent, they'll reach out to me, although we don't have we don't have a pager service, so there's a lot of limitations. And a lot of it is based on how quickly I can get back to them and so forth. I definitely can help patients with making decisions about general health, and I have lots of good traditional naturopathic interventions for all sorts of primary care concerns, using hydrotherapy and nutrition and herbs and rest, different kind of teas and so forth. That said, that really only functions for patients who I have an ongoing relationship with and who have been working with me for some time. And where I have limitations is certainly on certain types of medication management, because I just don't do it enough. And I really prefer to have someone who's much more comfortable to make decisions about people who are on a lot of medications and they're trying to decide, do I need this medication? Do I not? They've been to a ton of doctors. And I usually want to send them to someone who can help. And I think that Dr. Democker is the perfect person for that, for one thing. And so, that's one place. Also, people who just need an annual exam and who want to have a relationship with us, they want some simple, easy things for some basic concerns. Or maybe they do need a medication. And so they're trying to really integrate the complementary care with the medications that they may actually need. So, all of this is a place where, I can see our primary care practice really shining.
That's great. Thank you so much, Dr. Orceyre. And Dr. Democker, maybe before you even talk about kind of your approach to primary care, I think our patients don't know you well enough. Maybe just tell a little bit about your history, like how did you end up doing what you're doing? And I'm pretty sure our patients would love to also hear how you approach the patients, and especially the kind of complexity of care you did at RISC, which is a war-related serious injury program at the VA, which you were directing for a number of years.
Mm-hmm. Yeah, thank you. I'm excited to join this group. After family medicine residency, then I did get to go out and train with Dr. Weil. And then I ended up opening my own clinic in North Carolina and ran that for about a dozen years. And it was essentially integrative care, primary care. And so I was dealing with a lot of folks who had the basic primary care issues: blood pressure, cholesterol, fatigue, trouble sleeping, GI problems. But they wanted to see if there was a different or better way to treat some of their issues. And so with my background and training in Western medicine, as well as the integrative, it allowed me to draw from a number of different areas. So, we would use Eastern medicine, traditional Chinese medicine, acupuncture, some of the manual body work, herbs, things like that, to really optimize what they need. Sometimes a medication is particularly helpful in their case, and sometimes we were able to use other things, or sometimes both. So I was really focusing a lot on lifestyle. That's looking at diet, exercise, stress levels, kind of, who the patient actually is. I ended up coming up to DC to work at as you mentioned, the VA's War-Related Illness and Injury Study Center. I've been the medical director there for the last 7 years. And we were consulting on patients with medically unexplained problems from across the US. And so if they had symptoms that really could not be figured out by their home team, then we brought them to DC to try to diagnose and come up with a treatment plan for them. So I'm excited about getting to do a lot of the same thing at the clinic here. We certainly haven't been set up in the GW clinic for seeing routine primary care, but I think a lot of folks have questions about some of these common issues, like their sleep or fatigue, or pain, cholesterol, a lot of the common issues. Are there other ways for them to treat that? And so that's basically what I enjoy focusing on. And we've got the network here to really support patients in a lot of different ways, depending on what seems best for them, as well as what kind of resonates with them treatment-wise, what they feel like they're most interested in. So we've got a lot of great options.
That's great. I think that I think you just hit the nail on the head with all this. I also want to pick both of your brains, because I feel like in the last, I don't know, maybe 3 months particularly since Omicron, so it's maybe even less than 3 months, it suddenly feels like I think we're going to see a major shift in primary care, because we're going to basically have this 10 to 20% of all the patients after Omicron develop post-COVID, and we're basically going to be doing this kind of post-COVID primary care. And I see how GW is struggling with the post-COVID clinic. There's such a limited capacity, and everybody afraid of these patients, honestly. Like, I've talked to many primary care docs who are like, we have no clue what to do. And so I think part of, I want to pick your brain, but I also want to put to our patients is that I think, in contrast to many primary care, we're actually perfectly positioned to take care of these patients, because we already do this. I mean, we look at the problems from functional perspective, not from, well, is there underlying medical condition? We don't necessarily care about that often. Patients come with particular problems, and our approach would be functional. We'll try to fix the problem without worrying about the diagnosis. So I think that's also a problem with generally how primary care is established, right? You have to have diagnosis, and then there's going to be some kind of prescriptive treatment. We're in business of making people solving their problems. It's not necessarily fitting with the standard model. But maybe both of you can go in any particular order and say, like, when you guys work with a particular problem, and Dr. Orceyre gave us a couple of examples of some of the treatments she's using, but maybe instead of treatments, you can talk a little bit about philosophical approach, like, well, how do you follow and you can just think of a particular condition if it's easier, and maybe spend a couple of minutes each to talk about that. Yeah, and Deidre, why don't you go first, since we'll just keep that same.
Sure. Okay, great. Okay, so well, I'll just stick with the post-COVID, long COVID kind of scenario, because it's coming up so much lately. And as I see it, there's quite a spectrum of the post-COVID, those lingering effects, from very, very mild and almost like, is it really related to the COVID I had, or is it just a bad day kind of symptom, to people who are very severely ill and cannot get relief for their symptoms, and their life is pretty compromised. And I know you see a lot of those patients at the GW COVID clinic. So my philosophy, of course, with these patients is get to know them and understand who they are, both, physically, and also in terms of lifestyle, in terms of their capacity for making changes in their life, what they're able to do. I think, I don't want to go too far off on a tangent, but one of the mistakes I see often in medicine is that the doctors just kind of throw things at the patient and don't really understand what the patient's capacity is, And so we spend a fair amount of time getting to know patients in the intake, and then really identifying, first of all, which systems are involved, But also what we understand functionally about the COVID infection is how it affects the energy in the cell and how the cells produce energy. And that does seem to be missed quite a bit. There's just not really a good approach for that conventionally, but we have lots of ways to support that. And then, of course, with the stress hormones that can be involved, many people have heard about the adrenal hormones, and those can be taxed by the infection and by the post-infection symptoms. So, it's a multifaceted approach. It's looking both at the overall health of the person, and then their immune system, of course, their the intracellular energy, which is affected by all the nutrients, the vitamins and the minerals, the antioxidants that they're ingesting or that they have as a baseline. And then of course, lifestyle stuff, diet and exercise, etc. So we're looking at all of these things and working with the person. We're also not just telling them do this and you'll be fine. We're going to have a follow-up, see how it's going, make adjustments as needed. So that's one small example.
Yeah, I agree. I think getting the opportunity to get to know our patients and get a better sense of them, because in conventional primary care, you've got your 15-minute slot to solve all of their problems. And it's not possible for anybody to solve anything more than the most urgent problem in front of them. So what I see happens a lot is patients will go to their doctor. Their doctor will offer a prescription for whatever the problem is. And patients often get started on these, but then they don't ever get stopped. And so often patients are getting medications to fix problems caused by other medications that they're on. My philosophy is I like to see, ideally, if we can get people in a healthy space and balance by really looking at their lifestyle. How's their sleeping? How's their diet? How's their stress levels? And then the medications, the supplements as needed, but I like to minimize those. And so very often, for common problems like blood pressure, cholesterol, things like that, we can often get people off of some of these medications with modifications. And so I think the average person in general, they're finding over the age 65 is on 5 or 6 or more medications. And I generally find that we can eliminate a lot of those and really get it down to just, can we modify some things? The medications or the supplements are helpful to get people to a good space if we need to, while the other modifications are being made. But I prefer to try to fix the problems rather than just band-aid them on an ongoing basis with medications. So that's kind of the same philosophy that that it sounds like Deirdre's talked about.
That's great. Well, I think I don't want to keep us too long. I think our patients already got the gist of it, but I do want to say something. You even two of you haven't heard about this yet, and that's since Sharon joined, I've been sort of thinking, how can we keep supporting patients in a more innovative ways and kind of a more just more global access. And so we're of course already doing telemedicine, but we haven't been doing a lot of home visits. And I'm actually interviewing a nurse with 20 years of a home care experience. And it's very possible that we will have her join on very part-time basis, because I often find that doing home care is really important. And that we can actually not just do the home care, doing the assessments at home, but come and have IVs done at home, nutritional IVs. Come to do counseling at home, face-to-face, for some of our older adults who really have a hard time with telemedicine, and really do pretty much whatever is needed at the point of their residency, at the point of care there, rather than trying to bring people physically to the clinic. It seems like the whole healthcare system shifting that way. COVID is not going to go away, So I think we have to learn and adapt to this changing environment. And that's my last point. So maybe we'll go around and you each say like your, I don't know, departing wisdom pearl.
Well, I love the idea of the home visits, and I think the telehealth has given us a little window into people's homes, because having done home visits before, I think it gives us a whole different dimension of getting to know the patients. So I think that's one of the silver linings of COVID, is that we're going to keep some degree of telemedicine, and that would be great if we can actually be meeting people in home. I think that just gives us more information, and is obviously helpful for a lot of our patients. So that's great.
So I actually have two little things to say. One is when Sharon, when you were talking about, polypharmacy and people being on so many medications, in my mind, I was thinking, yeah, and supplements. So that's another piece of how we help people, is sometimes people come in and they're on like 40 different supplements. And so what we can do is help refine, what do you need anymore, and which ones are working against each other and which ones are redundant, and we do that all the time, and that's really kind of a primary care thing. And then lastly, I also, Sharon, I'm so interested to hear, I actually didn't know that part of your position at the VA was sort of like being the house, like Dr. House, of solving mysteries of people's illnesses. And that comes up quite a bit in our clinic, and it's really great to have someone who can think outside the box and who, can help us figure some of these cases out. And I know there are a lot of people out there who are in that situation where no one knows what's going on and they're really struggling, and, but they know something is a problem. So they would be great candidates to come talk to you too.
And Dr. Democker is not like Dr. House. She's a lot more personable, and she does not driving anybody crazy at the center. So, well, thank you so much, both of you, for joining. Thank you, everybody listening. I think that's all the time we have for today. So I'm Dr. Kogan from GW Center for Integrative Medicine. And if any of you would like to schedule with us for primary care establishing and continuing, our phone is 202-833-5055. And of course, our website is www.gwcim.com. Stay safe. Take care of your health. We'll see you soon. Bye, everybody.